coughing, shortness of breath. These conditions don't seem overly serious but are the only symptoms found in people with idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis, or IPF, is a progressive disease caused by scarring of lung tissue. IPF is an interstitial lung disease, meaning that it affects the tissue and space around the alveoli, the air sacs of the lung. Damage to the alveoli will interfere and reduce gas exchange with the blood, preventing oxygen delivery to other parts of the body. Being an idiopathic disorder, the cause or causes of IPF is unknown. However, studies have identified numerous factors that may increase one's risk of developing IPF. This includes genetic predisposition and possibly environmental triggers such as cigarette smoke. One way or another, individuals with IPF will experience damage to the lungs and their body undergoes excessive wound healing, making the lungs thickened, stiff, and heavily scarred. Normally, when the lungs are injured, the immune system recruits many cells to the site of damage, including a first defense line called macrophages. Macrophages are immune cells that prevent further damage and infection by removing dead cells, debris, and infectious agents by engulfing them. They also direct the body's immune response by releasing chemical signals called cytokines. The cytokines will signal fibroblast cells to begin wound healing in the lungs. Fibroblasts are cells building the scaffold of all organs. They do this by releasing a structural protein called collagen and other ECM proteins to reestablish the structure of the connective tissue. In the context of tissue damage, fibroblasts will transform into myofibroblasts to contract and close up the wound. In IPF, fibroblasts and myofibroblasts tend to remain active and proliferate, forming cell clusters known as fibroblastic foci. The accumulation of these cells means ongoing production of ECM components, which is why the lungs of IPF patients become scarred and stiff. To diagnose IPF, your doctor will first collect information about your medical history to rule out other possible conditions and determine potential causes of your symptoms. Then, a physical exam is performed using a stethoscope. It is estimated that 15,000 Canadians have IPF. In general, there is no geographic distinction for incidence of IPF, and cases are reported globally in both rural and urban areas. IPF tends to affect individuals above the age of 55 and is more prevalent in men than women. Currently, there is no cure for IPF, and patients usually die after 2 to 6 years. In October 2014, 2 new drugs, Ofev and Esbriet, were approved by the FDA to treat IPF. It is not fully understood how these drugs work, but both drugs have been seen to slow the progression of tissue scarring. Lung transplants are also available for patients with more severe physiological deterioration, but requires patients to register on a waitlist and wait time that can take more than 2 years. Early death may be due to infection, rejection, or heart failure. Patients can also be given supplemental oxygen to combat hypoxia, or the lack of oxygen delivered to your body due to lung damage. Finally, doctors encourage patients to be involved in clinical trials for new drug treatments being researched. For more information on research about IPF, visit Dr. Martin Kolb's lab website from McMaster University. You can also learn more at www.demystifyingmedicine.ca.